All right, thank you so much for staying with the Monday Report. You're just in time for the town hall discussion. We're talking about whether we are ready as a country to fully reopen. The president says it depends on how prepared the counties are. One of the issues they were supposed to handle was having a 300-bed capacity isolation facility in each and every of the county. They've been given 5 billion shillings to do that. Only 12 have managed to do that. Let me show you those numbers really fast. Mombasa, 432. Machakos, 373. Nyeri, Kiambu, Wasingishu, Makueni. Those are guys who've managed to get the 300 capacity isolation facilities in their counties. Kisii also is there, Kilifi, Murang'a, Vihiga, and Kericho. But there's some who have not managed to do it, and those are the biggest numbers actually. Kirinyaga only has 14, Siaya has 19, Nyamira has 20, West Pokot 21, Bungoma 22, and Nyandarua only 23. That is where the concern really is, because it's just about 1 week to the reopening, possible reopening. The president says it depends on whether or not the counties are ready. This is the discussion we're having with one Dr. Mohamed Kuti, the Isiolo governor, and also the chairperson of COG Health Committee. Also joining us live is Jerotich Sei. She's an active citizen. She's also joining us to contribute on this discussion. Nerima Wako Ojiwa is also here. She's the executive director for Siasa Place. Dr. Mwachonda Chibanzi, the acting secretary general, KMPDU, is also with us. And Paul Masese is joining us live from Nakuru. Let's get this discussion on the road. You're allowed to chip in as well. Use the hashtag Monday Report at Trevor Mbija at Citizen TV Kenya, and we'll sample some of your questions during this broadcast. Governor, I'll start with you. So we know now that only 12 out of the 47 counties have the 300-bed capacity. With only 35 counties, will the 35 counties really manage to get this number by the end of the week, Governor?
Well, I don't think it will be all of them that they will have met the required 300-bed isolation. But I think we should not just judge preparedness only on the beds, although the beds are one of the very important yardstick to check preparedness. Counties' preparedness, I think, should be looked at broadly, while also the bed capacity is also a very important component. And I think counties are working very, very hard even on the aspect of the 300-bed requirement. But I must say counties have now formed, all the 47 counties have formed the county emergency response committees, which meet weekly and chaired by the county commissioner and the county governor. And it also, the membership is from the security team of the county and also the health and other sectors of the county government. And it also involves faith-based organizations, community-based organizations within the county. It's a multi-sectoral, therefore, team that meets very regularly, at least a week. And also, these committees have been cascaded downwards at the sub-county level, at the wards level, and even at the lowest administrative units. And also, the communities have been well organized through this Nyumba Kumi, which is being done by the national security team, and also the community health volunteers, which are the last mile in the structure of the health in the county. So I think this structure has been put in place in all the 47 counties, and they have been, especially the Nyumba Kumi and the community health volunteers, have been very, very effective in contact tracing, in creating awareness, in also ensuring if there are visitors from counties that have been reported COVID.
Governor.
So this structure,
the counties were given up to 5 billion shillings distributed across board. How come some counties are able to get the 300-bed capacity and others are not? And they were given almost, the money was distributed to all the 47 counties.
Well, I must say the 5 billion was distributed, but it was not distributed equally. It was not even following disease burden. It was following the Commission for Allocation of Revenue formula, which obviously gives some counties very high figures. For example, my county and Lamu, which are usually on that formula, Lamu is the last from bottom, and I'm the second. Isiolo County is second last. I got, for example, my county got 16 million. So I don't think the 5 billion was based on disease burden, but at the same time, I think counties have also factored in their supplementary budgets funds for COVID, and this is contributing to the improvement of preparedness.
Okay.
I must say also, preparedness is also about the number of health workers who have been trained. Okay. And counties have done very well there. A total of 17,500 health workers have been trained across all the 47 counties.
Yeah.
A total of also 60,000 community health volunteers, who I said are the front line, have been trained in management of possible cases that may arise.
Okay.
And in terms of recruitment, also some 6,000 extra health workers have been recruited across the 47 counties, adding the number of health workers who could prepare the counties. That's also a yardstick for preparedness, which I think the counties are doing very well.
Okay.
The issue of testing, I think, is a challenge because all counties need to have testing capacity. There are only now about 12 or so counties that are able, and we have 28 labs that can test COVID across the country.
Okay, hold that
problem,
thought,
I think,
Governor.
Is this.
Hold on 1 second. Let me bring in Dr. Mwachonda Chibanzi, the Acting Secretary General, KMPDU. Dr. Mwachonda, should we even be talking about reopening the economy at a time when the COVID-19 cases are rising, and we know that only 12 counties now are able to hold 300 people at a go? Dr. Chibanzi?
Can you hear me, Trevor?
Yes, go ahead.
So thank you. I think that's a valid question. I agree with the governor that reopening and looking at our preparedness should not just be limited to the bed capacity. There is the testing capacity, which he has gone ahead to elaborate.
Yeah.
There is the human resource element of it. So in reality, where we are is that if we do reopen, then we do expect an increase in the number of cases spread out across the country, the different counties. And that will have an effect on our entire state of COVID-19 situation. And in reality also is that, yes, the government and the president declared that we needed more health workers to be employed. But as we speak today, on the 29th of June, none of those 6,000 healthcare workers is on the ground. So it's been 3 months now. We are still yet to see the health workers deployed across all the cadres, from the medical officers, pharmacists, to the clinical personnel, that is the nurses, the laboratory personnel, and even the other healthcare personnel. So now, with that in mind, and with a week to go, and they are yet to be deployed on the ground. So what we are anticipating is that we are expecting to actually strain our healthcare workers, who are currently already strained because of the few numbers, and because also a good number of them are undergoing quarantine every week, as we see a good number of them are getting infected. And so that now brings into the big question of what you're asked. Are we ready to reopen given that state? And in reality also is that I think back in April, the governors came out quite clear that our healthcare facilities are not in the right state. As we speak, with what the data that you have and what we have was given from the 23rd of June, which is last week on Monday, we still are yet to see the full state of preparedness across all these sections that we've mentioned, from infrastructure, equipment, ventilators, oxygen supply, human resource requirement. So as we speak, up until 6th of June, unless something changes between now on 6th of June.
Yeah.
It will not be the best of decision to go ahead and do that, knowing that what we're anticipating next is an increase in the number of cases across all the counties.
All right. And let's bring in Jerotich Sei on this as well before Governor responds to that concern. Jerotich, what do you see as the main concern here before we reopen?
Thank you so much, Trevor. Can you hear me?
Yes, you're loud and clear.
Okay. You know, just listening to those who have spoken before me, one of the things that occurs to me is at the rate that healthcare capacity is growing in Kenya, it might be another 10,000 years before we are reopened. In other words, how I've looked at it and how I understand it is hinging healthcare capacity at county level on whether we open or not open the country, for me, just does not make sense. If anything, COVID has exposed what I call political hypocrisy, disdain for the poor, and, shall I say, the expedience of the middle class. At the very beginning, we say the government needs to set up a rapid response team across the country in different areas, multidisciplinary, the ability to understand that we need to move fast, act fast. And what I have seen is almost a molasses-like response to COVID. When I hear that county committees are meeting weekly and we're dealing with a pandemic of this proportion, it makes me wonder whether we are in the middle of development programming or in the middle of emergency response. And the other thing I want to say about the health space and the health system, not too long ago, we understand that we spent 63 billion shillings on medical equipment services. And there was another 4.9 billion that's supposed to go towards healthcare information technology. We have a health infrastructure that is a black hole for resources. So even if we're talking about 5 billion shillings being dispersed to counties, and I agree with the governor that that amount is not nearly adequate to do what it needs to do, we are just basically throwing good money after bad, good money after bad. And for me, where I sit, I'm most concerned about the people on the ground. It's not about beds. It's about, are people alive? What happened to people's livelihoods? And what are we doing to cushion them? Because you may have a bed, you don't have people resilient enough on all other levels. Hence my reference to the multidisciplinary nature that we require when planning for such a response. And I'm just seeing that there's a disconnect across the board. We are dealing with healthcare infrastructure that is fraught with corruption. How on earth will we ever be able to be ready to reopen the country?
Okay. Governor, let me come back to you, Governor Kuti. All factors held constant. You are a medical doctor. You are the chairperson health committee in the Council of Governors. You advise the president and you also in collaboration with the Ministry of Health. Do you genuinely believe that as it stands, we should reopen the economy on the 7th of July?
Well, I must say that no country in the world is, from our experience, from what we have seen, from the time China, then Europe, then America, and then here in Africa, no country can fully say they are ready anyway. And I think even the most developed countries were found flat-footed and their systems were overwhelmed. I think we should not whine too much. I think we should be hopeful. It's now over 100 days and we are not overwhelmed. And I'm sure those countries that the so-called developed countries, by this time, they were so overwhelmed. And I think that also gave us the jack to, or rather the kick to prepare ourselves. And I think I would also like us to fully understand it's not so much only how we prepare as government. I think it's also the issue of the awareness that the government has put in place. And in any case, quite a significant proportion of how we can control this pandemic is based on citizen discipline. It is based on awareness. Social distance is something that is a very significant component of controlling this disease. Face mask, hand washing, these are actually very, very key ingredients of controlling this disease. Therefore, I don't think our health system has come of, it has challenges. Definitely, it has a lot of challenges, but I'm sure every day we get better.
Yeah, Governor, how many beds do you have in your county?
Pardon?
Governor, how many beds do you have in your county in Isiolo?
I have 13 ICU beds,
yes.
6 of which are, I have 13 beds, 6 of which are ICU, and 7 are HDU.
Okay.
And I have 85 isolation facilities, and I think, beds.
Yeah.
And I think based on about 200,000 or so citizens in my county, we are not on target yet, but we are not very far.
So, but the report that was given
as I was saying,
Governor, the report that was given, hold on one second, Governor. The report that was given to the COG indicates that you have 217 beds. You're saying now that you have about 100.
I think the number I'm talking about is isolation beds in the referral facility, but in the whole county, I think that's the correct number, the 217.
I'm running some pictures here, Governor, that show there was some movement of beds from Galaxy Hospital Annex. Did you move beds from Galaxy Hospital Annex to fake a resemblance of having the 300 capacity while you did not actually have it?
Well, I think if you listen or if you read that saga, which my opponents want to use to mess up the good picture that we're working very hard in Isiolo County, I must say. When we started, we didn't have quite a lot of facilities in Isiolo County referral facility and even in the rural health facilities. We have improved the number of, the distance when I came, the distance between health facilities have been 49. We have reduced that one significantly by adding more health facilities.
Governor, you're not answering my question, sir.
Issue saga, referring to this Galaxy saga,
yes.
There's no, Galaxy is a very small private facility in Isiolo town with 3 ICU beds.
So how do you explain that movement then, Governor?
Can't fit 13 beds.
What was that movement about?
Following that saga, followed this all the way to MEDS where we got the beds, and actually we had a leaders meeting involving the senator who actually put the matter in the floor of the Senate, and all the elected leaders, national and county leaders were present, and the county director, DCI, brought back his report and confirmed that all the 13 beds are from MEDS. The Senate committee have come to Isiolo, and they are soon going to give out their report that all, and I want to repeat again, I'm the chair of COG Health. I am in the National Emergency Response Committee appointed by the President.
Okay.
And I have been elected 4 times continuously by Isiolo County. I cannot be able to let them down to be that low. But whoever brought that saga and brought it to national limelight, it's either me who will be stooping low, or it will be that person who failed to check their facts. Therefore, I think in that meeting of leaders, the DCI brought us the fact that all those beds were actually from MEDS, because the investigation went all the way to MEDS and confirmed.
So, Governor, how much more do counties need so that they achieve the 300-bed capacity as we speak? Because it's clear that we mentioned the 5 billion wasn't enough because it wasn't distributed equally. So how much more in approximate math do they need?
I think definitely resources will never be enough. I have not calculated exactly how much, but I think I will not, as much as the president has put 300 as the figure, I think, these are, like now, the 200 and something in my county is more than enough. In fact, I'm rated like the ICU and everything at 350%. But I think we should not just concentrate so much only on the beds. As I was saying, the issue of availability of PPE is a form of preparedness. Are our health workers protected? How prepared are we to protect our health workers so they don't fall sick from exposure? So, and I want to give you this figure that KEMSA, as we're sitting, and I want to appreciate the effort by the national government, that PPE, that is personal protective equipment, worth $2 billion right now is at KEMSA, and we just even today got communication from the Secretariat of Council of Governors that we should not spend any money on the PPE because the national government is equipped properly. And I think the fact that we also have enabled our own manufacturers to come of age and participate in supplying the PPE and requirement is also a very positive thing. So these are all issues that we need to look at. And as I said also, the education that is happening on the ground, the communication that is happening on the ground through local radios, through the local vernacular is very, very important, because, as I said, the preparedness should not only be looked at the government side. How prepared are the citizens? You see a lot of people are still wearing masks, but they are wearing on their chin rather than covering their mouth and their nose, which actually are the orifices through which the virus will most likely will go through. So I think we have to balance all that. But I must say that I really sympathize with His Excellency the President, because on the one hand, you have to look at the lives of the people by protecting them from this disease. But as we do this lockdown, the economy is heading to its knees. On the other hand, also, people have to feed. And therefore, a balance has to be arrived at. And I think we have to open slowly. We should not let go of the floodgates, all of it. But step by step, we need to bring people back to getting to their livelihoods as they also care about their lives.
Hold on that thought, Governor.
Balance, or rather a two-pronged approach of preparing the counties and also preparing the citizen by upping our awareness
and sensitization. All right. Hold that thought, Governor, for a bit.
Hold on 1
second.
And again, this is not like a switch.
Yes, Governor. Hold on for a bit there.
It's not like a switch. When we say on 6th we open, then everything goes haywire. It's a continuous process of improvement.
Hold on for a bit. Let me bring in Nerima Wako. She's the Executive Director, Siasa Place. Nerima, what are your concerns tonight?
Thank you, Trevor. In fact, as the governor was speaking, I actually just received a text message from an individual in Vihiga confirming that county governments did receive budgets, but a lot of them were not necessarily prioritizing on beds, isolation centers, items like that. And that's a concern when we see money is going to counties, but then there's this lack of accountability. But I think also the fact that we're not even discussing ventilators, yet that's an important part of the equipment that is necessary, including PPEs. But ventilators, we can say that in our country alone, even in our capital, we can't even say that we have more than 20. And that's a very, very huge concern. And when we see young people coming up with innovative ways, why can't those people be funded even better to be able to capitalize on those resources? But another thing I think that I see is, as much as the committees exist, one thing we're not mentioning is that those committees often lack young people's participation.
Okay.
And even though we now move into home care, we're not talking about that a majority of that load, when we're talking about even if home care is going to be a possibility, will fall on women, and specifically young women. And that's not a conversation that we're having at the fore in terms of planning and preparation.
All right, let's bring in Paul Masese on this. Paul Masese is tuning in live from Nakuru. Paul, what is your concern tonight?
Trevor, thank you so much. I think listening to everyone, the question as to whether we should open or not reminds me of one of the first statements I ever heard from a Kenyan when COVID containment measures were declared. And the concern was, I would rather die of COVID than die of hunger. So out here, a lot of people are faced with starvation. People have lost their jobs, and looks like they are going to wait forever. So if you ask any Tom, Dick, and Harry out here, they will tell you open tomorrow. But are we really ready to open? I agree with everyone who holds the view that we are not. And part of the reasons we are not is the making of government. The governor speaks to the fact that committees were put in place to help it to respond to the pandemic. But who sits in these committees? Right from the national government, right to counties. Who do you find these committees? There are lots of lost opportunities. Who is better placed to communicate about COVID?
Okay.
I mean, if the governor believes that civic education and discipline among Kenyans is one measure of preparedness, what is the government doing to achieve that? There is no cooperation, for example, with civil society.
Yeah.
Take an average county, rather than Mombasa, where we saw very good cooperation and coordination between the county government of Mombasa and the civil society. In a number of other counties, the civil society's role is not even heard about.
Yeah.
Nerima talks about young people who are innovative, who could help communicate using emerging media. Most of them are relegated to the peripheries.
Mm-hmm.
So my challenge to county government is to reflect. Preparedness, yes, is for the worst case scenario, but we should be speaking more to the role Kenyans can play to prevent further spread.
Okay.
We need innovative ideas to communicate about COVID.
All right. And on that note, let's take a quick break here on the Monday Report Town Hall session. This is my virtual audience are with me. Governor Kuti is also with me. We're taking a quick break. Keep your views coming at hashtag Monday Report at Trevor Mbija at Citizen TV Kenya. We'll pose some of those questions to the governor in just a bit. Right? See you shortly.